Welcome back to Untold Physio Stories podcast. I'm your host, Dr. E, with Modern Manual Therapy and Edge Mobility System. And my co-host is,
Dr. Sean Wells.
how's it going today, Sean?
It's doing great. How about you, Erson?
Great. You getting ready to go on New Zealand vacation, huh?
Yeah, we're heading to New Zealand next week. Excited. It's going to be a fun trip. Lots of hiking and hopefully some really nice weather and exploring some new things.
Yeah. Well, because I'm a Christian and a big geek, I thought that Sean was actually going to go to Hobbit Town or something, but it turns out he's going for surfing and the rest of the country, like
imagine that.
right, yeah. For those of us who are big Lord of the Rings fans, and I'm talking about especially the movies more so than the books, even though I do like the books as well. We think that that is the only thing that you get out of New Zealand
Yeah,
is
not the waterfalls or the glaciers or the whales.
no, nothing else. I mean, surfing that was really new to me,
Ah,
so that's cool.
I'm
Yeah.
looking forward to it.
All right. Well, that's not what we're going to talk about today, but I just thought that I'd make some banter. So yeah,
Sounds good.
I've had some recent cases. One acute tendinopathy
Hmm.
and insidious onset, or what the patient thought, and another one, a semi like subacute, probably calf strain. And neither one of those kind of fall into the category that I normally like. Can you guess any particular reason why those are not my favorite types of cases?
Uh, my guess is they're nagging, and sometimes you don't really respond quickly to a lot of our interventions. So, yeah, patients can be impatient, and I know that we also, as providers, can be really impatient too.
Yeah, I mean, I once had a mentee call me out on something. I said during a mentoring session, we were just talking about atypical patients. I said, "Yeah, I don't really like it when people don't fit my clinical practice patterns." And he just said, "That's because you got to put some work in." And I was like, "Well, yeah, that's an honest take. I mean, because people fit my clinical practice patterns, they tend to be what McKenzie calls arrangement system syndrome, what I call rapid responders. Then you do some simple repeated loading strategies, maybe some isometrics and a little manual therapy to spice it up, and you look like a rock star. But
Yeah.
with true tendinopathies, they say you got to load them, of course, right? So if you got to
Yep.
load them, not necessarily for the muscle strain, but for the tendinopathy, you got to load it to take to increase strength of the muscle, to take load off that abnormal tendon that is highly sensitized. So both of these cases were they had very difficulty weight bearing. They had a lot. The antalgic gaits was very similar. They neither one could really had a good heel strike. They kind of landed flat, and they didn't like to push off either. One guy, even before without pushing off, instead for some reason he had this strange compensatory hip hike. Like he would
Okay.
actually like fire his QL instead of actually pushing off. So I thought that was kind of odd.
Okay.
Um, so both of them had also severely limited dorsiflexion, and I checked lateral tibial glide, and cause that's my first go-to. And a long
Hmm.
time ago, my old reset used to be plantar flexion and inversion before I started doing lateral tibial glide. And in both cases, their dorsiflexion, one had amazing dorsiflexion, and I was kind of surprised, and the other one had very
Hmm.
limited dorsiflexion. And both of them, their lateral tibial glide was kind of hit or miss. It didn't really improve their complaints. So I just said, I'm going to do my old fallback of repeated plantar flexion and inversion. I mean, I did all the muscle testing, and sure, for both of them, plantar flexion was very weak and painful, and resisted dorsiflexion was okay. Resisted
Hmm.
eversion was a little painful on the one with some calf issues. But the plantar flexion and inversion, both of them said they just felt like a great stretch in the anterior kind of talocrural joint. But then they were both amazed that the pain had significantly reduced along with the
Okay.
antalgic gaits. Um,
That's
and,
when
and
you
I
when
was
you
kind
say
of,
when you say plantar flexion inversion, how are you positioning them for that?
so they're in supine, and I just take their foot. So I take their forefoot and I'm kind of cupping their heel, and I just
Okay.
passively move the forefoot into
Got it.
inversion and plantar flexion. And
Okay.
I had done this also in the past for maybe plantar fasciopathy, because when you kind of twist, you can kind of twist the forefoot
Sure.
and also slack the medial arch.
Yeah.
And also you can kind of get the great toe into some flexion, because when someone's
Hmm.
usually missing dorsiflexion or they have trouble pushing off, they're missing great toe extension. So you could also give great toe flexion, which often improves and resets great toe extension. So yeah, both of them were obviously very happy. I would say
Sure.
they had anywhere between 50 and 75% pain reduction. And then for the one with a tendinopathy and not the one with the calf strain, because calf strain, I said, well, you probably still have to take some load off of it and try not to use it as much as possible.
Yep.
Try to avoid going up and down ladders because they do like a lot of scaffolding work, a lot of ladder work.
Okay.
Um, but the one with the tendinopathy, he did have like that thickened mid portion Achilles. So I started giving
Okay.
him just really light sustained isometrics. And then I just posted, I don't know if you saw it, like that it was like a Google LLM review of this chiropractor's amazing article. Like
Yes.
I thought I was gonna click upon, like, this guy just sells products just like me.
Yeah.
So he writes articles, and I just thought I was going to click on like this blog post, like, you know, this is the stuff that I think you should do, and here are my products that help it. Meanwhile, he writes
Yeah.
this like amazing literature review,
It,
right?
it is fantastic. Yeah, I'm about three-quarters of the way through, and the way he's summarized so much research and like kind of the progression over time of how this is how we used to think, and now this is like kind of what we're moving towards. I was like, man, this is really well put together.
Yeah, and he still like sells his products at the end, but I'm like, man, this guy deserves to have you buy his
Yeah,
products. I mean,
seriously,
because he's totally justified it. So for those of you guys, I'll post a link to that. But just
you
FYI,
should.
just real quick, like, um, he goes over why isometrics may help with pain modulation, but also the type of isometric you should use. So you could use a sustained isometric, particularly in an extent like a lengthened position, to kind of restore tendon like fluid dynamics,
Yeah,
and it needs to be 70% of their max contraction, and that's kind of like one of the best strategies to help a tendinopathy over the eccentric loading. And I was kind of getting away from eccentric loading anyway, and even because he said that research was initially promising, and then it kind of shows that like it hasn't really been helping as much as we thought, because up like 60% of people still have pain when on an eccentric loading program. And he also said that it's probably because it's just painful, and we're basically
yeah,
telling people to suck it up.
yeah, yeah. I've had
Yeah,
several clients who just, especially like with tennis elbow, not want to continue that protocol because it's just so painful. And
it is
so I've
painful.
moved to
Like
isometrics,
you're replicating the thing that hurts. It's like saying like, well, the thing that hurts is the thing that makes you better, and
right?
I just want you to be compliant because I say so, and
It,
let's fingers crossed.
I've moved to isometrics, but I think the thing after reading his article that I've been missing is that 70% of maximal voluntary contraction. So using my handheld dynamometer that I have, the active force, I'm actually able to sort of quantify, at least on the non-painful side. Now I know that's not exactly a one-to-one, but it's better than guessing, and I can kind of get an idea of how much force that needs to be for the patient so they can kind of replicate it.
Sure, sure. Yeah, I've been saying, I mean, even though I also have the active price, I've been saying just push what you would consider like 70% of your effort.
70%. Yeah.
Right. And it would be in
Yep.
a lengthened position. You do like 45 to 60-second isometric holds. So that's one thing. But then he also goes over the pain, like why are some of them so painful? And it's about like this cortical inhibition. So he's
Yeah.
like, in order to improve cortical inhibition, then you can do rhythmic isometrics. And he didn't really get into, I have to look at the article that he was referencing, because he said to a metronome. So I just imagined doing it to a metronome, because I did it for my like kind of low back pain that I figured out was a glute tendinopathy. So not only did I do a couple of like lengthened, like almost submaximal holds, but then when it was hurting, I was just kind of like, I put it in a lengthened position. I tried like different twisting. So this is kind of like where I'm adding like my stuff to his recommendations. So I
Sure.
just started lengthening it, because I couldn't. Side glides are painful, so then I tried lengthening it. Then I did like, I pretended there was a metronome in my head. I was like boom, boom, boom,
Boom, boom.
boom, boom, and so it's just like those rhythmic contractions isometrically, whether lengthened or not lengthened. I tried it like shortened, I tried it lengthened. It turned out lengthened actually made it feel better, and it modulated that pain pretty quick. Because in the eclectic approach in modern manual therapy, I use isometrics. I try like one or two, and if it,
Yep.
I abandon it. If it makes repeated loading pain free, like it often does, that's great. But I never thought about either a sustained hold. I didn't think about it in a lengthened position, and then I certainly didn't think about doing it like rhythmically over a couple minutes to a metronome.
Yeah, no, that's really novel. And I've seen that once before. One of the personal trainers that used to work with me had experience as a balletist, and he used to use rhythmic movements, particularly for gluteal issues. And I remember him having someone in a plie type squat and bouncing. And I was like, what are we, what's the point of that? And he said, well, I'm trying to get her glutes to engage in a rhythmic pattern. And at that time, I was like, okay, I'm working on isometrics, I'm working on eccentric. Well, that time it was probably mostly eccentrics because that was what all the data was pointing to. And here he
Hmm.
was ahead of his curve, I guess. So
Yeah.
really cool.
Yeah. So now I'm thinking, if someone has like retraction and side bending issues, and normally I just kind of do this or manipulate them or something, and like I always go for the ISO first. I mean, I recently accidentally discovered on myself that a sustained isometric in neutral helped my left low back pain. But now, now I'm trying it in sideline. Or now I'll try, or not sideline in lengthening position, or now I'll try lengthening position to a beat. And
Sure.
I think that just more ways to help reconceptualize it. But I also wanted to get back to the point where he was talking about when the fluid dynamics are changed in abnormal tendons, that like the sliding of fascicles is somewhat altered. And I think, well, maybe that's why slacking seems to work so much. Because in
Yeah.
both of these cases that I'm talking about, repeated plantar flexion and inversion ended up slacking the calf or slacking the tendon, and maybe we restored some sliding and fluid dynamics,
Yeah.
and then then you add that with the sustained isometrics and the repeated loading, repeated isometrics, and I think that's really what made a difference. What
It's
could
really
make a
cool.
difference. It's only been one case,
Sure.
but anyway, I think I got to run because I have an electrician. But thanks for coming
All
on,
right.
Sean.
Yeah, absolutely. It's great,
Yeah.
great
All
chatting with you,
right.
and I look forward to the next one.
Yep. If you guys think this is interesting, have any comments, make sure to reach out on social media. And as always, please rate Untold Physio Stories 5 stars wherever you listen to podcasts, especially Spotify and Apple's. That helps our discoverability. And you guys have a great day. We'll see you, Sean. Have a great vacation.
Take care. Thanks. Bye bye.